This meeting comes at an opportune time as we emphasize the importance of health and safety in general and TB interventions for the mining sector in the 10 countries in the region.
There's no doubt that the rate of TB prevalence amongst miners in this region is one of the highest in the world, actually the highest in the world, so 7,000 per 100,000, and that it's 10 times more than the communities from which these miners migrate. It has to be having a bottom line impact on profits of companies in terms of lost work days. It has to be having an impact on both local communities and the communities from where miners are from. And therefore it's a problem that I think there is widespread interest amongst many stakeholders to try and solve.
The World Bank recognizes that TB control is a major public health and economic development priority for Southern Africa, and indeed for the world, and must be tackled forcefully.
This meeting has been called Smart Investments because we are here to explore ways of investing the limited resources available to address the occupational and public health challenges, hence SMART.
Funding from governments and development partners have produced a wealth of evidence in the Southern Africa region, guiding us forward as we venture further in the areas of developing occupational health policy and legislation, scaling up occupational health service delivery, applying new information technology, and developing regional health information management systems, just to mention a few.
The broader challenge, however, that we face is that making progress in our own houses and in our own homes is not good enough in the face of many things around us burning.
The primary role of public health rests with the government, but the government can't do it alone. So there is a need for a strategy or the model to bring the three people on table, discuss this at the beginning, so that when the strategy comes out, it will be sustainable and will be owned by the people.
You bring essentially the government, a third party like the Global Fund or the World Health Organization, and the mining company to develop a capacity that otherwise would not be available if you mandated each one of those entities alone to deliver health services.
We know that the footprint of mining will always be there. But if we work as a collective civil society, government and business, we could actually mitigate some of those things so that we ensure that we have as minimum as possible the impacts that we are having does not affect negatively on the community that resides on.
So what next? You know, it's important that, you know, we all come together, we deliberate, we discuss, and we go home. But for TB in the mines, this has not been the practice.
It is time to go back home. And when we go back home, we need to engage. And most importantly, we need to act. So my parting words is action, action, action. Because if we do not act, everything else will stay in this room and will die in this room. Thank you.